As measles cases climb across the globe and a new case reported right in our province this week, being vaccinated against the disease is becoming more and more important. Joining us now to talk about the current level of concern over the disease is Dr. Isaac Bogoch, an epidemiologist with the University Health Network. Thanks for being with us today, Doctor.
My pleasure.
Now, we've just had recently a few measles cases confirmed in our part of the world. Why is that enough to get the attention of health officials, doctors like yourself, and just the general public?
Yeah, so we are seeing a rise in measles cases globally, and the World Health Organization raised that significant issue a couple of weeks ago. We know there's very significant human mobility. Canadians like to travel abroad. We know there's many people coming to Canada as well. And in general, our rates of vaccination in Canada are very high. Of course, there's certain pockets where it's lower, and we need to work on that. But the concern here is if we let those vaccine rates slip, we might see subsequent chains of transmission in the case of imported measles cases. And it's very important that people are up to date on their measles vaccines, both so that number one, we don't get infected if we travel abroad. And number two, if we see an imported case of measles, we don't have big chains of transmission when people land in Canada.
How is measles transmitted between people?
It's transmitted through the air. And in fact, it's one of the most contagious infections on the planet. If someone is unvaccinated and in some proximity, not even very close proximity, you can be in the same room as someone with an active case of measles, there's a very, very high likelihood that the infection will be transmitted.
Just how serious is measles if you happen to catch it?
Yeah, that's a great point, because there's this myth that measles was some benign childhood infection that everyone used to get several decades ago and everyone recovered from it. But that's not the case. In fact, it can cause serious issues. Many people who get measles will have other infections like bacterial infections. Measles can cause inflammation of the brain. Even in 2024, there's about 120 to 140,000 deaths per year on the planet related to measles. Most of these are in kids, so this is awful, and this is all preventable.
Health officials just down the road from us in Brantford are reporting a new measles case this week in a child who traveled to the UK and then came back here. March break, as we know, is just around the corner. So many families will know about dopey traveling. Why is this a particular concern right now?
Yeah, well, when you see a resurgence of cases of measles globally, and then you have a lot of Canadians who might be traveling outside of the country, you want to make sure that everyone's safe. And it's just important that everyone's up to date on their measles vaccines. Of course, during the darker days of the pandemic, someone might have missed some routine vaccinations. And there's been big pushes from public health units to make sure that everyone is up to date on their vaccines. I know that some places have had vaccine campaigns in schools and in community centers. There's certainly been a lot of communication about that in case someone might have missed a dose of one of the routine childhood vaccinations. But it is important before you travel abroad to make sure that you're up to date on your vaccines, just so that if you are exposed to this infection, you don't get it or bring it back.
People might be thinking now, I can't remember. Did I get that vaccine for the measles? Did my kids get it? What are the kind of steps we have to go through to remind ourselves if we did get it, and what do we do if we didn't?
Pretty straightforward stuff. Yeah, everyone's got a vaccine card. Find that old yellow card lying in the sock drawer somewhere, wherever it's kept. And if you have any issues or any difficulties with that, it's important to speak with a healthcare provider. And I know there's depending on where people are, there might be some challenges finding a healthcare provider. Remember, you can talk to a doctor, you can talk to a nurse, you can talk to a pharmacist, you can talk to a public health specialist. There's vaccine clinics all over Ontario. So there's lots of different healthcare providers that can help families walk through this.
Okay, so getting vaccinated, number one thing you could do to protect yourself. Is there anything else that maybe parents could do to make sure their kids are safe if for whatever reason they haven't been able to get vaccinated just yet or can't?
It's a good point, because usually the first dose of the vaccine is given at around the first year of life. That's when the first dose is given. And for kids, it is a 2-dose vaccine. But if you're traveling to an area and that area might have measles, you can actually boost that first dose of the vaccine up to as early as 6 months to help protect an unvaccinated child. So I think it's important that people recognize that. The other important thing is that the second dose of the measles vaccine was only added in 1996. So there's a lot of people out there who might think they're fully vaccinated but have only had one dose. So if those people are traveling to an area where might be more measles circulating, it's important that they get that second dose.
Did you think you'd be back on TV talking about measles?
Unfortunately, yes. This is an issue that's predated the pandemic, and there's been terrible proliferation of misinformation and disinformation long before COVID-19. And we have seen this issue with people choosing not to vaccinate themselves or others for routine childhood immunizations. In fact, about 25 years ago, there was this article in The Lancet that falsely linked the measles vaccine with autism. Now, of course, that was retracted. That was 25 years ago, and we're still reeling from that. So this is an unfortunate problem. It's getting worse, not better, with some of the misinformation and disinformation campaigns circulating on social media, because people ultimately read these and look at these, and some of them will make poor decisions for themselves or their family. This measles vaccine is safe, it's free, it's widely available, and it's extremely effective. So it's obviously a good idea to be up to date on that one.
Dr. Isaac Bogoch, thanks so much for being with us today.
My pleasure.